Hi, I'm Deborah Kobza. I'm Executive Director, CEO of the National Health Information Sharing and Analysis Center. I'm here at the Health IT Summit here in beautiful Palm Springs, California, and just came off from a presentation talking about national health cybersecurity resilience. The National Health ISAC is the nation's information sharing and analysis center for healthcare and public health, working with Department of Health and Human Services and DHS and the health sector. We're in the process of developing a national health cybersecurity resilience system and a supporting framework, working with NIST and the National Cyber Framework effort that's going on right now to develop a health sector focused version, and also working with DHS and coordinating efforts statewide across the country to put in place a national cybersecurity response system for the nation's health sector. I think a couple of the key points was around cybersecurity and risk management, and really providing the opportunity for the health sector to have a defining voice in how to protect their systems. Another key point was on cyber intelligence and information sharing, being able to not only as an ISAC sending out threats and advisories and alerts around cyber intelligence, but also being able for the health sector to share that information back with the ISAC, because that's the only way we're going to move from a reactive stance that we're in right now to a proactive stance. The other part that's very important is about education, being able to educate a cybersecurity workforce across the health sector from a role-based perspective. I'd say is to be able to be aware of security situational awareness, what's going on out there, what threats are out there, what vulnerabilities, and not just to understand it just how it's impacting the health sector, but what is impacting other critical infrastructures. Is something happening in finance or in the supply chain or electric or water sector that can cascade into the health sector or vice versa? My biggest piece of advice is to implement a risk-based approach, to get the support and have your CEO be a champion of cybersecurity for your organization. A lot of the larger healthcare organizations already recognize that, but there are a lot of smaller organizations that are still working in that process. But to really engage not only in security, intelligence, and information sharing, but to engage with the other sectors through an ISAC, whether it's through the National Health ISAC. I know a lot of the providers and payers are also members of the Financial Services ISAC. So you get intelligence from both sides. But to really leverage the NIST cyber framework as a risk management framework to be able to address cybersecurity resilience and to leverage those resources and not have to duplicate efforts.